How does co-testing help screen for high-risk HPV? Imagine catching a problem early before it becomes serious. That's what co-testing aims to do for cervical health. It combines two important tests: the Pap test, which looks at cervical cells for abnormal changes, and high-risk human papillomavirus testing, which detects the presence of the types of HPV most likely to cause cervical cancer. This combination makes screening more effective because it catches potential issues from two angles. The Pap test can find cell changes that might develop into cancer, while the HPV test identifies if high-risk virus types are present that could lead to those changes. When both tests are used together, they improve the chances of detecting precancerous conditions early, especially in women aged 30 to 65. Because co-testing is more sensitive, women who test negative on both tests can wait longer before the next screening, up to 5 years, without increasing their risk of developing cervical cancer. This longer interval is safe because the combined tests give a clearer picture of a woman's risk level. If the results are mixed, say, a negative Pap but a positive HPV test, that signals a higher risk, and healthcare providers might recommend closer follow-up, like repeat testing in a year or a visit to a specialist called a colposcopist. On the other hand, if both tests are negative, women can continue routine screenings confidently. For women who test positive for high-risk HPV, genotyping can identify if they carry types like HPV 16 or 18, which are known to carry the highest risk for developing cervical cancer. This information helps doctors decide whether immediate follow-up, such as a colposcopy, is necessary. It's a way to catch potential problems early and start treatment before they turn into more serious issues. While co-testing might lead to more follow-up procedures than just doing a Pap test alone, it offers a more complete picture of cervical health. This approach aligns with guidelines from major health authorities, which recommend co-testing every 5 years for women in the right age group. This strategy has been shown to be effective in detecting high-risk HPV infections and early cervical changes, helping prevent the progression to cancer. In the broader context of reproductive health, cervical cancer is strongly linked to persistent infection with high-risk HPV types. Co-testing is a key tool in early detection and prevention, saving lives by identifying issues before symptoms appear. It's important to remember that each person's health situation is unique, so always follow your healthcare provider's advice. Regular screening with co-testing can significantly reduce the chances of developing cervical cancer, making it a vital part of women's health care.